Namaste friends. In this video we are doing functions of prefrontal lobe and simultaneously we will also do prefrontal syndrome, that is when this lobe is not functioning or lesioned. Prefrontal lobe is this part of cerebral hemisphere, we can say most anterior part of frontal lobe. Science of this lobe is associated with a very famous history. So let's look into the history first. Phineas P. Gagg is remembered as one of the most famous patients of neuroscience. He suffered an unfortunate accident in which prefrontal lobe detached from rest of the brain. Even after such an dangerous accident, he survived. And his doctor said this famous line, I dressed him, but God cured him. Although down the line, his personality and behavior changed so much that his friends said that possibly he is no longer Gag. This is the place where Mr. Gag was working when the explosion took place and an iron rod entered in such a way into his brain and separated prefrontal lobe. In fact, after observing the changes in Mr. Gag, we start coming to know what possibly this part is doing. With this background, now we are starting discussing 10 important functions of prefrontal lobe, and we will do this under 5 headings. So let's see the headings first. Because prefrontal lobe is especially big in human beings, scientists used to think that it must be area for intelligence. Although area for intelligence turned out to be Wernicke's area, but they were not totally wrong in sense that many aspect of higher function or intelligence is completed by prefrontal lobe. So our first heading is role of prefrontal lobe in higher functions. Then we came to know that it also play a very important role in motor function. So next heading is its role in motor function. This area turned out to be area or part of limbic system. So it play an important role in limbic function. These three are major function, but eventually we came to know that it play some role in sensory function also and some role in other function also, other functions also. So these are 5 headings under which we will discuss all 10 functions of prefrontal lobe, its role in higher function, its role in motor function, its role in limbic function, its role in sensory functions, and some other functions. Let's do first two function under the heading role in higher function. The first one is development of working memory. This is also called elaboration of thought. Whenever a person is engaged in any intellectual reasoning, when he say any professional is working, at that time he develops a special type of memory called working memory, which is developed during the work and terminated soon after the work. For example, when a doctor is diagnosing a rare disease, when a lawyer is fighting a case in the court, when a mathematician is solving a difficult mathematical problem, or for that example, any professional when he is performing some difficult work, or even when we are planning our future, or we are speculating what can be the consequence of our motor activity, and then we decide the motor activity. So during all this time working memory develops. In prefrontal syndrome it will be affected. The second higher function of this lobe is prolonged concentration. Without prefrontal lobe, the person cannot concentrate even for minute, and just it's a matter of time, matter of minutes, that he will be distracted from the main theme. Now third function is under heading role in motor function. So this is planning and programming of complex motor activity. Because prefrontal lobe is part of caudate circuit, it decides which motor activity to be selected during difficult situation. So this is planning and programming of complex motor activity, first three function and first two headings. Let's again see the first three function in full text, how you can write in the examination. The first function is related to higher function, development of working memory. Examples are planning future, solving complicated mathematical, legal, philosophical problem, or when a doctor is diagnosing a rare disease, and when we are judging the consequence of our own action. That time the second important higher function is its role in prolonged concentration, and in prefrontal syndrome the patient is distracted from main work within minutes. Second heading is a role in this should be B, role in motor function. So this is planning and programming of complex motor activity. Prefrontal lobe being part of caudate circuit, it plan and program complex motor activity in the new and difficult situation. What motor activity should be planned and in what sequence? Obviously in the prefrontal syndrome the patient is engaged in useless motor activity which is not having any purpose at all. So these are first two headings and first three functions. Now we are starting the third heading, and especially this part of prefrontal lobe, we can say anterior, inferior and medial part, and this part is belongs to limbic system, so deals with all the emotion. Under this heading we will actually do three function. First is that all the emotion and behavior are disturbed, and that include the mood also. So if this lobe is not functioning in prefrontal syndrome, the mood swings from extreme way, in extreme way, from we can say from sweet to psychotic. He may be very sweet at times, and in no time he may be furious or psychotic. The behavior is also disturbed in prefrontal syndrome, and the patient does not care the proper behavior in terms of moral ethical laws. And his affection is also affected. In prefrontal syndrome, the patient lose affection virtually with everybody, with family, friends, even for future, even for himself, does not care at all. So such changes happen in prefrontal syndrome. This way it is concerned a lot with limbic function or emotion and behavior. Let's again see these three functions in text, how we can write in the examination. Function number 4 is that it is related to emotion and behavior, and that's why in the prefrontal syndrome, mood swings from sweet to psychotic. We can say wild mood swing. The prefrontal syndrome patient does not follow moral and ethical laws for sex, hygiene, and excretion. And in prefrontal syndrome, the patient loses all the affection for family, friends, society, even God, oneself, and one's future also. The most important function already we have completed. Let's do the remaining function. It's also having some role in sensory function because previously, when no strong medicines were available for intractable pain, like the pain that happens in the patient of cancer, prefrontal lobectomy used to be done. And then pain used to be there, but again, the patient was not bothering about pain. So, one function is related to pain threshold, and that is also one function, and remaining function are some, it must be some role in autonomic function, because in prefrontal syndrome there is incontinence of urine and other sphincters. Also, feeding habits are affected, hyperphagia, patient eats a lot, he's not well oriented, he or she does not take anything seriously. So these are some other functions. Let's see same function in text, how you can write or one can write in the examination. The fourth heading is role of prefrontal lobe in a sensory function. In prefrontal syndrome, pain threshold is increased and the patient does not bother about pain. So this lobe must have some function related to pain threshold or sensory function. Same way, some role must be there for autonomic function, as the patient of prefrontal syndrome complaints of incontinence of urine. Same way, the patient also shows or present with disorientation, tremors, hyperphagia, that is increased appetite, and does not take anything seriously. So some other functions are also likely.